Hello and welcome back, and thank you all for subscribing, right, and liking. Thank you very much, okay? All right, so today we're talking about neurological anatomy and physiology, okay? Kind of elusive for some people. Some people struggle with this section, but it really isn't that bad. And I'm going to teach you about this using our magic number 3 for different sections. We'll start at the smallest section and work our way up, right? So, anyway, what are we doing? At RN Cliff Notes, we're helping students see through larger concepts. And my name, Cliff Davis. I'm Associate Dean of Nursing and longtime Advanced Medical Surgical Professor. Okay, so we said we're starting small, right? Okay, here we go. What is the smallest unit of the neurological system? And you say what? Neuron, right. Okay, no problem. That's easy. So, on to bigger and better things. Now that we know that we're talking about the neuron, let's break the neuron down, right? Using our magic number 3. And anybody that's been in my class before, you know you should always have a piece of paper handy. So, you know what I mean? Click on one of my videos, you're in my classroom, whatever it is, take out a sheet of paper, right? Yeah. So here we go. All right, number 1, 2, 3, go for it. What are the parts of this neuron, right? Fill that in. Pause the video if you need. Okay. What are the answers? So we've got number 1 is the dendrite. 2, cell body. 3, axon. But now, let's break it down because we don't want to forget this stuff. We want to know it. Knowing it for the exam is good. We want to know it for good and for our careers. Okay? So, let's hop over here and check it out. We've got dendrite, which I want to point out to you. Dendrite sort of looks like hair a little bit on the neuron. I know it's kind of weird, but you know what I mean? Just flow with me. Anyway, looks like hair on the head of a neuron. All right? You think of the cell body as the head, right? And then in dendrite, in the word itself, we've got the letters I and N. This is where nervous impulses go into the cell, into the dendrite. All right? Then we've got the cell body here, and you can see the nucleus. Then here we've got the axon. And what's important to remember, especially for examinations when you're studying medicine or nursing, right? This is where the nervous impulse does what? Exit out of the neuron. So the dendrite's where what? IN comes in, it goes into the cell body, and then the nervous impulse does what? Exit out of the axon, right? Great. Great. Again, our magic number 3. No problem. Okay, now, again, another set of 3. So we started small. We were talking about the neuron, right? Now we want to step that up a little bit and talk about the different types of neurons. All right, and if you know these, go ahead and fill in those boxes. If you can't see this that good, you've got a finger right there, and it's got nervous impulses there with the finger, and this one says, neurons conduct signals from receptors in the finger, from the receptors up to the central nervous system in the brain. So, right, this one picks up the signal and sends the signal up to the brain. All right. Number 2. Number 2, the other name for that is an association neuron. And these neurons are generally confined to the central nervous system, brain and spinal cord. And these types, you want to think of the word between. Between is important, right? That's how that one functions. We'll come back to that. All right, now, box number 3. Neurons conduct signals from the CNS, so from the brain this time, right, down to things like muscles and glands. That's a picture of a muscle there. So, from the central nervous system, down to the muscles. That's number 3. Whereas number 1 was from the receptors, up to the brain. All right. And the answers are, okay, so in box 1, sensory neurons. But let's not stop there. Okay, I mean sensory, yes, we get it. So you touch something and you can sense that you're touching it. You can sense that it's warm. You can sense that it's sharp. And those impulses, those signals are being sent what? Up to your brain. Great, got it. However, come examination time, usually your instructor is not that generous to slap sensory on there, right? It's probably going to be this other term that's in parentheses, afferent. Afferent. And what do you do in the morning? You what? Arise. You get up. Okay? Afferent. Arise. Up. Right? Here's another kind of corny twist that you can use to learn it, but it works. Corny works sometimes, eh? All right? So if you had afferent spray, what would you do? Put that spray in your nose and spray that spray, and where does it go? Up to your brain. Afferent. Okay? Compared to, let's jump down to 3 here, which is a motor neuron, right? Motor. Whenever a muscle's moving in your body, that's a motor activity. And what's the other name here? Efferent. Efferent. So what is it? What happens? This particular type of neuron causes a muscle effort in response to a signal reaching it, right? So sensory or afferent sent the signal what? Up to the brain. Whereas efferent neurons or motor neurons, the signal came down from the brain to the muscle and caused the motor effort. Great. Now, number 2 here is a little bit tricky because this is interneurons. And remember, we mentioned that word between earlier. That's what inter means, between. So these are the kind of neurons that help send signals between other neurons, right? Especially in the reflex arc in your spine, right? So in between. It's almost like the interstate. When you get on the interstate, what are you doing? You're going from, it's in between 2 places. In between. All right, so we want to look at the anatomy of the brain. This is something that truly gives students a hard time, and it's hard to retain the information. However, if you use study smart strategies, you will know it forever, okay? So, quick breakdown. What we got? The frontal lobe, where? In the front of the brain. We've got the parietal lobe, off to the side, a little bit higher. And we've got the occipital lobe towards the rear of the brain, or the posterior aspect of the brain, right? And then we've got the temporal lobes, which are on both sides there. And the cerebellum, which is the lower aspect of the brain. And spinal cord here, brain stem, all right? And let's look at that a little bit larger just in case you couldn't see it. Okay? Yeah. So that's our breakdown of the brain parts. We're going to get into some pretty good detail with this. And first off, though, you guessed it, your turn, right? Always, what do we say? So what I want you to do is, according to lobe and according to function, in terms of the parts of the brain, what part of the brain, right, for number 1, is responsible for eyesight? What part of the brain is responsible for hearing, for number 2? Number 3, which one's balance and coordination? Number 4, which one handles body temperature? Number 5, which part of the brain handles respiration, pulse, and blood pressure and things like that, right? Vital things. And then 6, which other part of the brain helps out with the respirations? And 7, what part of the brain is responsible for coordinating body sensation? And if you don't know those things, congratulations, you're watching the right video. All right? Okay. Pause it if you need to fill this in. If you don't know it, here we go. Let's teach you this stuff. All right. First off, occipital lobe. We take that letter O, right? And let that remind us of an eyeball. Occipital lobe, right, located in the posterior aspect of your brain, is responsible for coordinating sight. Yeah, eyesight, occipital, not bad, right? Pretty easy if you just remember the 0 or the letter O. Here we go. Temporal, pretty easy. Your temple, right, and your head are located proximal or very close to your ears. And that's the part that they're responsible for, hearing. So temporal lobe of your brain, what? Is associated with hearing. No sweat, right? Let's keep it moving. All right, so the next one. A little bit more to this one, right? A little bit deeper with our study smart strategy. So in this one, we want to think of cerebellum. Bell, right? We want that to remind us. And here you go. Your cerebellum is responsible for balance and coordination. Now, what I want to point out to you is this Liberty Bell is gigantic, right? And let's say that these people were asked to move the Liberty Bell. Well, they need to move the bell without having the bell sound. That large bell like that sounding, the inside of it making contact could probably break glass or maybe hurt somebody's ears being really close to the bell while they're moving it, right? So let's say you got a couple people in the front, a couple people in the back, and they're helping each other to move that bell, right? But they don't want it to ring. And what are they having to do with each other? They're having to what? Stay balanced, and they're having to stay coordinated and stop that bell from ringing, right? Cerebellum, balance and coordination. No sweat. Here we go. All right, now, this one. So the hypothalamus is the part of your brain that's responsible for body temperature. Now, in terms of word association, we want to think about hypothermia. Sounds a lot like hypothalamus, at least in the initial or the outset of the word. So hypothalamus, what? Hypothermia. Hypothalamus is the one that controls body temperature. Right? Got it. All right, now, medulla oblongata. Wow. Well, this one's a little bit deeper than the other associations. And first glance at it, you're probably looking and going, what the heck is going on? So let me break this down for you. It's an unfortunate circumstance, but it actually helps us learn, right? So you probably can't see the picture that good, but we got a couple police officers arresting a young man. And this young man, his name is Freddie Gray, and this is his scenario. So, police officers, I don't know the initial charges, crime, anything like that. But anyway, they got a hold of him, put him down on the ground, and one police officer, in the videos, you see him standing on Freddie's back. And the police officer's boot or shoe is rather high up on Freddie's neck. And he's got his full body weight on him. He's a larger officer. And you can hear Freddie underneath him, hey man, oh that hurts, oh, right? So anyway, eventually they cuff him, stand him up, and they're taking him to the police wagon. But here, let's break something else down for you. Let's say, or let's think about a time that you ever smashed one of your fingers, right? You smashed that finger pretty good in the door or whatever it was. What happened to your finger? Your finger did what? It swelled up. It didn't swell up instantly, but it swelled up slowly, right? All right, and in some cases, twice or 3 times its normal size. Well, what I want you to think of is the officer standing on the back of his neck there and applying pressure, full body weight, and then when he lets up, Freddie's back of his neck and this area is starting to swell. And it's a very interesting thing if you ever get to see that video, which is hard to do, by the way. If you ever get to see that video, you see Freddie looking like he's struggling. And unfortunately, the officers are looking at him in his struggle and thinking, okay, now he's trying to put on a show, right? So you see him in the video and he's cuffed. And as they're taking him to the wagon, you see him getting worse as he's on his way to the wagon. And he's, oh, man, oh, man, oh, man, oh. Right? And it's like he's getting worse and worse on his way to the wagon. Finally, when he gets to the wagon, they literally have to lift him up to put him into the wagon. And that was no show. the back of his central nervous system was swelling and becoming edematous, and he was having difficulty walking. And that is what it is. I mean, that is a repercussion of the full weight of a human being being on the back of a smaller man. So, unfortunate situation, but in this case, like I said, it helps us to learn. Now, there's more to that. So they put him in a wagon, and as they're driving him back to the police station, and instead of taking him right to the police station, the GPS on the wagon actually shows that they are actually going around the block a couple times. And they tend to do that sometimes in their culture, which, you know, when people give them a hard time when they arrest them, instead of taking them straight to the police station, they do that. So anyway, as they're turning these corners, right, as opposed to going to the police station, they turn the corner, right, turn the corner again, right? What's Freddie doing in the back of the wagon, right? You guessed it, right? He's falling. He's going from side to side, hitting the back of the wagon. Well, anyway, when they got to the police station, they opened the doors, and his chest is not rising and falling. He's not breathing anymore. And it's like, whoa, what's going on? Rush him to the hospital. Then the video cuts to the hospital where he's ventilated. And why did he need a ventilator? Because the officer was standing on the back of his central nervous system and applying too much pressure to his medulla oblongata. And what does your medulla oblongata control? Respirations, pulse, and blood pressure, right? Once that swells and gets damaged, then now your ability to breathe, your pulse, your blood pressure, these things will be directly impacted because your medulla oblongata got damaged. And by the way, that word, we want to focus on that word because we got several words that we're dealing with, but the words tend to be straight up, even though they're medical terms, right? We're talking about what? Occipital, temporal, parietal, right? But then out of nowhere, instead of temporal, we got what? Medulla oblongata. Like out of nowhere, we're starting to speak Latin. Like, what's going on? Why isn't it like frontal like the rest of them, right? Why does it have a special name? Because it has a very special function. By the way, I want you to pay attention to this medulla. We're going to see that in this series. As you're looking at RN Cliff Notes, we're going to see medulla come up a lot. And when you hear medulla, you want to think middle. That's exactly what that is, medulla, middle. It's the middle of something. And in this case, what's this the middle of? It's the middle between your brain and your spinal cord. Medulla oblongata. Okay? So yeah, super important. All right, moving on. Pons. Pons is located near your medulla, but helps your medulla with respirations. This is kind of like your backup system. Your medulla is doing most of the work, but the pons also help out. Why? Respiration is critical in terms of survival. But what I want to point out to you is that within the spelling of the word respirations, pons is in there, right? Respiration, P-O-N, pons, helping out your medulla and maintaining your respirations. Got it? No problem. Okay, parietal. All right, now we get ready to be a little deep here for just a second, but that's all right. So here we go. Let's move this thing over here and use this as sort of a prop, I guess. All right, so when you see the word parietal, what I want you to think is perimeter. Okay, what am I getting at? When we say the perimeter of something, actually I can probably use this here. When we say the perimeter of something, we're talking about what? We're measuring it what? All the way around. All the way around. How much is this distance all the way around? And now, since that's all the way around, by word association, we want you to realize that parietal, just like perimeter, is what? Sensation of the body, what? All the way around. So, if a nurse or a doctor is doing an assessment on you, and they ask you to close your eyes, right? and identify what body part they're touching, you can say, oh, you're touching my right arm, right? You're touching my right leg. Why do you know that? Because of your parietal lobe in your brain, right? Not bad. Not bad at all. So, body sensation all over your body, the parietal lobe, perimeter. Good. Okay. Now what we want to do is revisit that stuff, especially if you didn't know. Okay? Let's try you out, see if you got it. All right? So, first up, what was it? What part of the brain controlled the eyesight? Occipital lobe. Yeah, that's right. Remember that? Oh, eyeball. Okay? What part controlled hearing? Temporal. Yeah, near your temples. All right? You got it together. Okay, balance and coordination. What was it? The bell, that's right. Cerebellum. Okay? And then now, body temperature. Ooh, body temperature. What? Your body's too cold, your body would be hypothermic. And that would be the what? Hypothalamus. Good job. All right, how about those respirations, pulse, blood pressure, all of that? Vitals. Huh? Medulla oblongata. All right, some of you probably said medulla. Let's get that last name too, right? Medulla oblongata. Sounds better. Okay. Then now, respirations. Kind of backup system for the medulla. What do we have? It's the what? P-O-N. The pons. All right, guys, good. And now, finally, body sensation, right? Body sensation, which one is it? All the way around? Parietal. Look at you. All right. Not bad, right? Yeah. Okay. So again, that's the end. I'd like to thank you guys again for subscribing and liking. All right. And we'll see you next episode, okay? Stay tuned, guys.